Hello everyone, my name is Tedros. I would like to present today about myocardial infarction. But before that, I have to tell you something about me. I have sludge pronunciation, so take it easy. And
Slow,
also I have a
but can
low
you get the
pitch
charger?
uh, vocal, so I'll try my best to make you sure all you will see my presentation. Okay. About today's presentation is about myocardial infarction. Myocardial infarction is it's a medical term which is a combination of three words. The stands for myo means muscle, cardio means the heart, and infarct means muscle tissue with lack of oxygen. So this is very serious disease which is worldwide, affecting all kinds of people, all kinds of age, and it's a very serious about 33 to 30 to 50, well, yeah, sorry, 33 to 55% of deaths every year is due to myocardial infarction. According to CDC, which is the Center of Disease Control and Prevention, it's a private agency, they report that 735,000 deaths every year in the United States is because of myocardial infarction, which is about half of the population of the United States. This is due to smoking and using illegal drugs and the lifestyle, of course, because due to high demand of food, all our foods are manufactured and processed, so their content is very hazardous to our health. Right. So the cause, what's the cause? The main cause is, it has a lot of causes, but the main cause is this cerebral atherosclerosis. This atherosclerosis is due to three things. It can happen in our system or circulation. The first one is the high level of LDL, which is low density lipoprotein, which is we can find it from the food we consume every day, and our body also produce enough in our daily lives. But if we add the food we eat, if we consume like high cholesterol foods, it leads us to atherosclerosis. The second is saturated fats. The saturated fats are all foods we eat every day, especially the meat, the dairy, and other processed foods. With this food also can lead us to atherosclerosis. Third one is the trans fats. Trans fats are all manufactured or processed foods or food items like trans fat. There is a name for trans fat, like hydrogenated oils. We found them in every stores, which is labeled by hydrogenated oil. So this item, this type of food is very hazardous to our health, and also leads us to atherosclerosis. So atherosclerosis is a blood formation of blood in our blood vessels, especially in our coronary artery. So this is formed into three forms, which is the clot formation, the coronary artery disease, like initiated by through diabetes and other serious illnesses. So this is how it begins in our body. So naturally, our heart is a different organ from the other organs because it has very special structure unit, which is a blood vessel, the coronary artery, and the coronary veins, which is very unique. You cannot find them in other organs of our body. So this artery or this vessel supplies blood to the entire muscles of our heart. So if something happened to this vessel, our life is compromised. So this coronary artery is affected through these three processes, which is the first one is the main initiation of all these things is the atherosclerosis, which is a complete blockage or plaque formation in both sides of the endometrium of this vessel, or partial, which is one-sided without this, so it's partially blocked. There is a flow of blood, but it's very low. This leads to a clot formation, which is this plaque formation is staying the upper part of this plaque formation is very hard, and the inside part is very fishy. But so this is very hard. The blood flow comes from the heart. Our heart pumps every day, almost 100,000 beats every day. So the power or the push, the pump of blood flow erodes this tiny membrane, which is very thin because of the plaque is protrude, and this endometrium lining membrane of the vessel is very thin and is very prone to erosion or laceration. So it might happen rupture or bleeding. So our body defense mechanism respond to the bleeding, which is to form clotting. So our platelets or the white blood cells release a clotting factor. This clotting factor also forms another blockade, which is blockage of the whole artery occlusion. So it called complete occlusion of the blood vessel. The third one is the coronary artery spasm, which is due to the dehydration or electrolyte imbalance it becomes. So once it contracts and then it never come back to relaxation. So blood flow to the heart muscles is low. So the part or the portion of the heart which is delivered by this vessel starts to necrotize. So normally if we take let's say for example this heart. I took a slide cut from here. So let's say this is the left ventricle and this is the right ventricle. So the thickness of part of this part, this myocardial muscle is very thick. So if something happened and to the entire thickness of the muscle, which is that's a complete blockage, which is like this atherosclerosis can make a complete myocardial infarct. Sometimes also it happens small portion, but which is a little blood flow, like I don't have the picture, but a little blood flow, which is a small flocule, but there is a flow, but it's a lower radius. So we call this partial myocardial infarction or partial occlusion. So our heart always in danger because of this our daily activity, which is our daily lifestyle. But the main cause for all this happening is the atherosclerosis, which is the plaque formation, which is by the three causes of which is high cholesterol, LDL, saturated fats, consumption of saturated fats, and consumption of trans fats. Right. Okay, diagnosis method. Mostly the diagnosis method is very common in emergency because heart attack always, myocardial infarction patients comes first in the emergency because it's an emergency case. It's acute attack or acute infection. So uh, the first thing you can do is the clinical history, which is history of the patient. You have to talk with him, or somebody brought him to the emergency. You have to get some information about him, and after that there is an EKG. EKG goes to the and for the checkup of electrical activity of our heart. And third, we can do a blood test. Blood test also for the checkup of troponin and other elements. This structural protein, which is found in the heart muscles only, comes from the base of the cardiomyocytes, which is the cells of the heart, which was stored before the heart was healthy, which is used for the energy of the heart muscle. So there is another test, angiogram, catheterization, and stress test. Stress test is very crucial because during stress, our body releases cortisone. So the cortisone makes our blood, our heart pump more and raise. So it gives extra danger to the infected patient at the same time. Okay, so this is what we do to our heart in our daily life. We consume a lot of fat, a lot of unwanted food particles. So as we see in the picture, this is the healthy one. So we don't see any plaque formation in here, but this is the affected one, which is in all parts of the four coronary arteries. This is a full or complete occlusion. Two of them. This is a partial, a very low blood flow. This is half occlusion. So, according to the picture, this part is completely down and completely blocked. So we don't have any blood supply over there. We don't have enough oxygen over there. This looks like when a myocardial infarction occurred. When you see the slides cut. Symptoms are varied from patient to patient, which is in some cases, girls are have very different symptoms like pain in the jaw. I don't know why this is happened to girls only. In boys, we see only the same thing, like compression, high pressure compress or tightness of the chest, and pain, which is radiated to the jaw, the arms, and to the back or upper body of the body. It goes and comes more than or equal to 30 minutes in every day. There is sweetness, shortness of breathing, sweetness, and nausea and vomiting. This is due to the backflow of blood to the lung, because, like we said earlier, this left ventricle always sees blood to the lung, and the blood flow. If this ventricle is not pumping properly, the blood flow goes back to the lungs, and accumulation of fluid in the lung gives shortness of breath or discomfort to the patient. Early morning fatigue, dizziness because there is no enough blood supply into the muscles. There is a cough, which is due to the blood flow to the lung or to the blood. There is no free movement of the bronchioles, or there is no free exchange of gas inside the lung. And there is highly racing heartbeat per minute. This is due to the cortisol release the trigger of cortisol release due to the pain through the days of the heart muscle cells. So I found this on YouTube. It's very interesting. So most of nurses, they use this